Discography is a diagnostic procedure to help determine the source of back or neck pain. Intervertebral discs act as cushions located between the series of bones called vertebrae that make up the spine. The discs act as a shock absorber between the bones while providing stability and allowing movement. The discs are made out of strong connective tissue. The tough outer layer is called the annulus fibrosus. The center of each disc, the nucleus pulposus, is gel-like in its normal state. With age, discs lose water content and become more narrow, less flexible, and less effective as cushions between the vertebrae. As a disc deteriorates, the outer layer can weaken and tear. A herniated disc occurs when the outer layer ruptures and the inner portion leaks out. If the disc travels into the spinal canal, irritation and pressure on the spinal cord or nerves results in pain. Discs heal slowly, during which time new nerve endings may form in ruptured areas. When the disc contracts the nerve endings, a chemical reaction takes place, causing irritation and pain. Disc problems can cause neck or back pain, burning or tingling sensations, numbness, weakness, and pain. Depending on the location of the disc along the spine, your symptoms may spread to your arms or legs. There are many methods of treating disc pain, but if treatments are unsuccessful after a period of time, a discography may be ordered to determine the exact disc that is creating the problem to formulate a more appropriate treatment plan. On the day of your procedure, you will be asked not to take any pain medication. To begin the outpatient procedure, you will be positioned lying face down. The affected area will be sterilized and numbed with anesthetic. You will receive a relaxing medication and antibiotics before your procedure. Your doctor will use a live X-ray to carefully insert and guide a needle to the outer layer of the suspected disc. Next, a second needle is moved through the first one and guided to the center of the disc. If more than one disc is suspected, the process is repeated. After the second needle is in position, contrast dye is injected. The contrast dye may cause temporary pain. You will be asked to rate your pain and asked if the pain is similar to that of your symptoms. If more than one disc is suspected, contrast dye is injected at each one, and then the needles are removed. The next step in a discography uses an X-ray to show where the contrast dye has spread. The pattern of the dye within the disc can help determine if the disc is abnormal, at which time a CT scan may be used to show more detail about the extent of the rupture or tear pattern, as well as the size and shape of the disc. You will be monitored for about 45 minutes before you can return home. Another person should drive you if you received relaxation medication. Your doctor will prescribe medication to ease the temporary pain from the procedure. A discography is not a treatment, but a diagnostic tool to determine the source of pain. Your doctor will discuss your results and options for future treatment after you receive your diagnosis.